3 weeks ago, the Minister of Health, Isaac Adewale, said that the outbreak of Lassa fever had affected 15 states with 31 deaths recorded. That has now changed to an alarming rate. 72 people have so far died of Lassa fever since January. That's according to the Nigerian Center for Disease Control, the NCDC. It did say this in its report, which says that 1,081 suspected cases were reported in 18 states from 15 earlier reported by the minister. Now, the World Health Organization calls it the worst outbreak of Lassa fever in Nigeria's history. The organization is concerned on the ability of the government and their agencies to rapidly detect cases of infection in communities and refer them early enough for treatment and increase chances of survival. The disease center in a statement said, quote, "Given the large number of states affected, many people will seek treatment in health facilities that are not appropriately prepared to care for Lassa fever patients, and the risk of infection of health care workers is also likely to increase." The affected states are Edo, Ondo, Bauchi, Nasarawa, Ebonyi, Anambra, Benue, Kogi, Imo, Plateau, Lagos, Taraba, Delta, Osun, Rivers, Gombe, Ekiti, and the FCT. Of the suspected cases, 317 are said to be confirmed, while 72 deaths were also confirmed, 8 of which are probable. Edo State remains the worst, as 43% of all confirmed cases are from the state. Let's sink our teeth into this. The Director General, National Center for Disease Control, Mr. Chikwe Ihekiazu, joins me from our Abuja studios. I want to thank you so much indeed for coming. Death figures stands at 72 and 317 cases confirmed as well. What, in your view, is fueling this figure?
Gimba, thank you for having me on your show. I think what is driving this outbreak is the biggest question on all our minds, and really the focus of detailed investigations happening right now at the Nigeria Center for Disease Control in collaboration with the World Health Organization and other partners. Now, there are 3 possible scenarios. Firstly, there could have been a change in the virus. Secondly, there could have been a change in the multimammate rat and its ability to transmit this virus to humans. Or thirdly, it may just be that our surveillance infrastructure and architecture has improved so much that we're simply finding more cases. Or it could be a combination of all 3, but that's really at the heart of the work being done by epidemiologists, virologists, all working together to get to the bottom of this outbreak.
Let me read a quote from your release very recently. Given the large number of states affected, many people will, of course, seek treatment in health facilities that are not appropriately prepared to take care of Lassa fever patients, and the risk of infection to healthcare workers is likely to increase. This seems to suggest that your hands are really tied up. Is that the case?
No, that's definitely not the case. I mean, we have really stood out and advised healthcare professionals all across the country to do the right thing, use universal precautions all the time. Nobody comes in with Lassa fever written on his forehead. We have very simple, straightforward tests to diagnose the common causes of fever in our context. Malaria, pneumonia, every fever needs a diagnosis. And once you've ruled out malaria, then the next thing is start thinking about other causes. So we have had very simple messages to send to Nigerians. Test before you treat. If it's not malaria, it could be something else. The earlier we know what it is, the quicker we are able to institute the measures to save your life. We've kept telling doctors and nurses to use hand gloves and other universal precautionary measures wherever they can. So I think more than ever before, we've come out with very strong messages, both for primary prevention among the population, but also for healthcare workers. And we're working with all the state governments across the country and our partners to really strengthen the ability to prevent this illness in the front lines. And the front lines remain primary healthcare centers across the country. And you know that the focus of this government's agenda really is to strengthen primary healthcare, which ultimately then will protect all of us from diseases like this.
Let's talk about the government. An interministerial committee to deliver if you will, a final blow to Lassa fever and other related diseases was set up by the minister himself when Lassa fever was first recorded early in the year. How much work has that committee been able to achieve? Are they really working to stop the spread when we're having figures that are on the increase rather than having them decrease?
Yes, so this interministerial committee really advises the work of the technical agencies like NCDC. We are the front lines together with our colleagues at the state government levels and really at the 3 hospitals at the heart of this. And you know, if you go to a place like the Rua Specialist Teaching Hospital in Edo State, they've built up so much capacity to manage cases like this. Now, the truth about Lassa is that there's no magic bullet. That's the most that we know at the moment. There's nothing that government can do to immediately stop transmission. We all have to pull together. State government, federal government, teaching hospitals, healthcare workers across the country. Also, you and I, in terms of prevention. You know, Lassa fever is transmitted by a rat. We have to keep our environment clean, make sure it is not attractive to rats to come in, and really protect ourselves. So I think our calling on all Nigerians, like always when we're faced with challenges as big as this, is to come together. We have some very simple, straightforward measures, but we have to do it consistently. There's no miracle out there waiting to save us. We've got to pull our resources together, as we always do, and rely on government to really drive this forward, which we are doing at the moment.
So what do we have now? 1,081 suspected cases reported within a space of 60 days this year alone. Where do you see this heading?
So we've really, in the last a few weeks, and really the important figure there is the 317 confirmed cases, because a lot of those suspected cases have been ruled out not to be Lassa. So over the last few weeks, at least the last 2 weeks, what has happened is we've all come together. WHO has come in, strengthened its response, and they support a few other partners and now working very closely together with NCDC. Now, 85% of all the cases are focused on 3 states, Edo, Ondo, and Ebonyi states. And those 3 states are also at the heart of our response. So in those 3 states, we've had rapid response teams there for 4 weeks now. We're strengthening those. We're going down to the community level, educating people on what to do to prevent this illness. And really, you will see, and Nigerians will see, that in the next few weeks, there'll be a strengthened response. We may find a few more cases because we're looking a lot harder, but I do think, and I'm very optimistic, that we'll see the end of this, and that we need to really focus on how we can support each other to prevent these outbreaks happening every year.
You did mention Irwa Diagnostic Center. We also know about a diagnostic center in Bayelsa State as well, we're told by the state government. Is that facility patronized, or do you know about it?
You know, setting up a molecular lab, there are many diagnostic centers that medical diagnosis is really a broad spectrum of diagnostic services. But having a molecular lab to diagnose specific rare viruses is not a very straightforward thing to put up. So we've got 3 labs, at least in the public sector at the moment, that we are using specifically. One is in Irua, one is in the Lagos University Teaching Hospital. The 3rd one is at the National Reference Lab on the outskirts of Abuja. So these are our 3 core labs for the viruses that we are working on at the moment. Now, there's a diagnostic center in many other parts of the country that support a whole range of other medical diagnosis, but these 3 are the ones we're using.
We must thank you.
However, having said that,
that will be a good place to. That would be a good place to let it rest. I do sincerely apologize. Thank you, however, for talking to us, the Director General, National Center for Disease Control, Mr. Chikwe Ikekweazu, for talking to us here on State of the Nation. But that's how the program has been today. Many thanks indeed for watching. We'll come up next week with a fresh package. Join us again. I am Gimba Umar, and this is State of the Nation.